Hi, in this series on fibromyalgia, I'm going to be talking about the main medications that have been approved or used for fibromyalgia management. Now, in the previous videos, I covered about the fact that the kind of pain that we see in this condition can be of three varieties, and often it can be a mixture of these three varieties. So one kind of pain occurs when there are chemicals that are being actually released at the site of any injury or an acute flare-up of arthritis, let's say. And that kind of pain is called nociceptive pain. There's another kind of pain where the nerve itself might be damaged or affected by other conditions like diabetes, multiple sclerosis, or Parkinsonism, or some conditions like that. And that kind of pain is called neuropathic pain. There's a third variety of pain now that has been recognized and accepted internationally, and this was called Nociplastic pain. So this pain is when the nervous system itself can get hypersensitive and stay overreactive. So in fibromyalgia, predominantly it is a nociplastic pain where the nervous system has got sensitized, but that doesn't mean that someone with fibromyalgia may not have an active element of ongoing arthritis, or they may have a surgery wherein they are having an element of acute nociceptive pain, or they may be suffering with diabetes which is uncontrolled and or Parkinsonism or other conditions which can cause a neuropathic pain. So treatments, when we look at it in terms of drugs, will have to tailor for these three kinds of pain and often a mixture of these pains. So what can we give? If you have an acute nociceptive pain, meaning that there are chemicals being released at the site of injury or surgery, then that's the time when you can expect anti-inflammatories, so non-steroidal anti-inflammatory drugs like ibuprofen or naproxen or diclofenac can make a difference. Paracetamol is likely to be helpful, or even codeine, and even for the short term, opioids like morphine can make a difference. So that is when you have nociceptive pain as a mechanism. If you do have neuropathic pain where there is been some evidence of nerve injury or damage, then that is the time we can consider of nerve medication. These would be antidepressants such as amitriptyline or nortriptyline or duloxetine, or they might be drugs that were used for epilepsy like gabapentin, pregabalin, and in fact other groups or other drugs that belong to this group itself. The last bit, however, when it comes to nociplastic pain, and I would say that in my clinical practice, a lot of fibromyalgia patients often have a predominant amount of nociplastic pain, things get a little tricky. We find that none of these drugs actually make a difference. And so in the most recent NICE guidelines, which is the UK's National Institute of Health and Care Excellence, that's our main body in the United Kingdom, which suggests guidelines for managing conditions that are evidence-based and cost-effective. NICE actually suggested that for chronic primary pain, and fibromyalgia is one of those conditions, we find that amitriptyline is the only drug they have suggested that might tick the box. They don't think that any other drug might be useful when nociplastic pain is the main mechanism. So this is something to keep in mind, that there are not that many drug choices that can be effective when it comes to treating fibromyalgia. Once you go beyond the evidence base, there is certainly some newer treatments that are there on the horizon. There is talk that drugs like milnacipran, which is right now present in the US, low-dose naltrexone, which has been tried in a few small studies, and even there is talk about the possibility of medicinal cannabis being useful in some patients which are chosen appropriately. So there is hope that we might be able to dampen the immune and nervous system sensitivity by using a different mechanism, but we don't have the evidence for that right now. Thank you for watching this video. I hope you found the content useful and of value to you. Please don't forget to subscribe to my channel and hit the like button for more videos to be notified.